Hi, I'm Jo Bailey and this is video 2 of a 4-part series about common misdiagnosed conditions in children. Today we're looking at the commonly diagnosed condition depression. Now all kids go through periods where they feel blue, where they feel down and sad and lethargic. But when sadness, negativity or fatigue last for longer periods of time, it is often misdiagnosed as depression. Now, having a long period of sadness doesn't necessarily mean depression, and depression is so much more than just sadness. So unfortunately, depression happens to be one of the most commonly misdiagnosed conditions, not just in children, but in people. Sadness is part of life and we have to stop pathologizing this condition. We have to stop treating it with medicines and realizing and accepting that sadness is just like any other emotion that needs to be experienced and processed. So let's have a look at some of the other factors that contribute to these misdiagnoses of depression in children. So number 1 is no surprise really, it's sleep problems. For the experienced clinician, sleep problems are indicative of so many mental health conditions. Often just by looking at someone's sleep patterns and behaviours, we can predict a mental health outcome. Research shows that teenagers who on average get about an hour less sleep at night than their peers were 38% more likely to feel sad and hopeless. And sadness and hopelessness are indicators in depression and suicidal ideation. But listen to this, 42% of teenagers who get just 1 hour less sleep at night than their peers were more likely to consider suicide and 58% more likely to attempt suicide. That statistic is frightening. We are talking about just 1 hour less sleep. So this is how critical and how important sleep is in our wellness, in our psychological health, and in mental illness. Number 2 is thyroid imbalances. Hormones can affect moods, energy levels, and irritability. For example, when thyroid activity is low, which is called hypothyroidism, it's associated with depression and fatigue and irritability and other presentations. SPECT imaging or SPECT scans of people with hypothyroidism will show overall this decreased activity in the brain. And when the brain is experiencing decreased activity, it's slowed down, which often leads to depression and other issues. Low thyroid and depression have been linked in over 430,000 scientific studies. So what this tells us is that in some cases, depression can be one of the very first signs of a thyroid disorder, and it's very important to have your thyroid function checked if you are considering depression as a new diagnosis. Number 3, poor diet. Research shows that high sugar foods, blood sugar issues and obesity are all associated with depression. Now sugar is hidden in all sorts of kids' foods. Even sometimes the foods we think are healthy have very high concentrations of sugar. In addition, depression is 2 to 3 times higher in patients with type 2 diabetes than in the general population. Number 4, undisciplined thinking. Unfortunately, one of the greatest lessons in life is how to deal with anxious thoughts, and there's very few schools that teach this. Children are not taught that they don't have to believe every little thought they have, and that thoughts are just thoughts. Children who appear negative may be filled with this acronym, and we teach them ANTS, automatic negative thoughts, and the little ants loop around in the brain and steal their happiness. Learning to question their thoughts can reduce symptoms of depression. Anxious children often have anxious parents or an anxious primary caregiver, and we tend to find that depression rides on the coattails of anxiety. If you are worrying about everything all the time, or you're worrying about specific things a lot of the time, then that negatively impacts your sense of safety and happiness, and in turn, that is obviously going to deplete your mood and ability to just relax and enjoy life. If you have a child whose thoughts seem to be undisciplined, dark or anxious, or you yourself experience this, then there are many evidence-based strategies that a good psychologist may be able to help you with and avoid a plunge into a depressive state and a diagnosis of depression. Number 5, head injuries. Depression is a common problem after some form of head injury. About half of all people with a TBI, a traumatic brain injury, are affected by depression within the first year. Even more, about 67% are affected by depression within the next 7 years after their injury. Now, a traumatic brain injury can be anything from a concussion right through to a more severe injury. Childhood brain injuries, including concussions, are associated with an increased risk of subsequent mental illness, poor school attainment, and disruptive or impulsive behaviour. People who have experienced even a single mild or moderate brain injury during childhood were at twice the risk of being admitted to a hospital as a mental health inpatient, and were 50% more likely to use a mental health service than unaffected people in the same age groups. So the impact of a head injury or a concussion may not be immediately evident, so it's important to be screening for a child's history in this area to help explain the nature and the cause of their presenting depressive symptoms. Number 6, environmental toxins. Environmental toxins can either be naturally occurring compounds such as lead or mercury or formaldehyde, or human-made chemicals such as the BPAs we find in plastics, phthalates and pesticides. Exposure to any of several metals in our environment can be associated with psychiatric diagnosis. Considerable evidence connects childhood lead exposure, including prenatal exposure, to diagnoses of conduct disorder, criminal behaviour, ADHD and depression. Exposure to any of several different types of chemicals that are used to kill insects may also cause some psychiatric symptoms. Recent research suggests that more physical aspects of the environment, so we are talking about things like noise or chemical pollutants, may also have a neurobiological impact and influence the risk of depression, especially among genetically susceptible individuals. In older children or teenagers, alcohol and recreational drugs, problem drinking, drinking abuse, binge drinking, and at-risk drinking behaviours all increase the risk of depressive symptoms, depression itself, anxiety, and even suicide. Remember, there is a difference between psychiatric symptoms and psychiatric diagnosis. If your child has been given a depression diagnosis and your professional hasn't gone through and ruled out other contributing factors, then you might want to seek a second opinion. Before giving your child a strong medication such as an antidepressant or an anxiolytic, please ensure a thorough investigation has been conducted. If you would like more information or set up an appointment with myself, you can find me at Healthwise in Queensland, and the website address is on the screen now. Join me in video 3 of this series, where we'll look at symptoms that are often misdiagnosed as anxiety. Until next time, take care of yourselves and each other and have a very happy and peace-filled day. Bye-bye.